Hello, dental online trainers, and welcome to the Dental Online Training Sharecast. I'm your host, Dr. Dennis Hartlieb. Each month, we'll talk with dental experts who are doing amazing work in the world of dentistry. Also, occasionally, I'm going to throw in a few of my solo bonding sharecasts, where I share a little with you about what I've learned along the way during my career. So tune in the first Tuesday of every month to hear the latest episodes. Hello, dental online trainers. Dr. Hartlieb here with you again with our Dental Online Training Sharecast. Today, I am super geeked to welcome in someone who is new to me. I'll be honest. So as I was talking to Diana just a few seconds ago, very often I'm speaking to people that I've known for years, and we have sort of this level of familiarity. I don't want to say intimacy, but familiarity. We've known each other for so long, and we've been at the same meetings, we've been in the same organizations and all that stuff. But Diana is someone who I've been watching off to the side a bit, and I've been really impressed with some of the dentistry that she's been presenting. And she's in a shared study club that I am in also. And she put on just a beautiful presentation for us recently. Why I wanted to bring Diana into our conversation is because I think she's doing some really awesome dentistry. As she and I spoke about earlier, it's not that she has this golden gift, but we'll talk about that, her gifts, but how hard she's worked. So Diana Tadros, you will also see her as Beauty in the Teeth on Instagram, if you're an Instagram follower. She is a University of Tennessee dental school graduate, right? Go Vols. Were you a football fan?
I'm a huge football fan, yes.
All right. So I wore my Michigan hat for you because I don't know if you know this. So Michigan and Tennessee have a little bit of a rivalry thing because back in the day, you guys had a certain quarterback who was quarterbacking for Tennessee, and we had a certain player at Michigan named Charles Woodson. And your certain quarterback, Peyton Manning, was like the shoe-in for the Heisman that year. And Charles Woodson had an incredible year. He's primarily a defensive back, but he also ran back punts and kicks and played on the offense. And he won the Heisman. And I was going to actually put up with it. The look on Peyton Manning's face when they said Charles Woodson instead of Peyton Manning is priceless. So that's always my Michigan, Tennessee little dig. And Tennessee has a huge football stadium.
Yeah. Well, I have to make it even more confusing for you because I'm a Knoll born and bred. I'm from Tallahassee, and then I went to UF for residency. But college football runs through my veins no matter which way you swing it. But Florida State is actually my initial love.
Well, and I was going to get to that because I know you're FSU, Tennessee, and Florida. Yeah. So you got three college, superpowers.
Yeah.
Not so much today. They're all kind of struggling.
Correct. I know. Today it's sad. In the 90s, though.
Yeah. Right. So I was just curious before we start talking about dentistry and everything, I was curious what your college football alliances, having gone to such three notable college football institutions.
Yeah. So Florida State is still to this day. I actually was in New Orleans for the LSU Florida State game, which is really neat because we're not in the SEC, so we barely get to play LSU. But UF, I am not a UF fan. All my friends and my family gave me hell when I went there for residency, but it's a phenomenal program.
Right.
After AGD residency there, so I kind of had to just bite it. I don't think my parents talked to me that year. They were really upset. Looking back, that was a poor decision, but no, Florida State is still, and it worked for Tennessee because I think Tennessee and Florida State's mutual agreement is that we hate the Gators. So
there we go. See, it's common enemies.
Yeah.
well, okay. So this is very, when I start talking about college football with some people who have gone to these type of programs and they're not into college football, it becomes a very uncomfortable conversation for me.
Right.
All of a sudden we don't have a lot to talk about if we can't, can't start with college football. So this is very gratifying. And I agree with you. So I think that if you're a Florida State fan, if you would have said that, yeah, you also rooted for the Gators, I would have, the respect level definitely would have dropped. So I'm very pleased to hear that you hate the Gators as much as I hate the Ohio State Buckeyes. Yeah. So sorry for all you Buckeye listeners. It's just and they should hate Michigan as equally as we dislike them, which I know.
For sure. So, all right. They understand that. They know what it means.
Exactly. And we are in college football season, so this is the way it goes. All right. So Diana, let me just finish up. You're an accredited member of the AACD. That was recent. Congratulations.
Thank
Beautiful
you.
work. I saw the ceramic work that MJ Shin did for your accreditation case, or for one of them.
Right.
If, for those who are listening, if you are not in the AACD and you want to do more cosmetic dentistry, it's a wonderful organization. And I encourage you to check out the AACD and the accreditation protocol and the whole procedures, because it's really just wonderful. And you're going to learn so much through the process. I think you'd agree to that, Diana. You learn so much as you go through
100%,
it.
100. I could talk hours about just the process itself and how it transformed me, but 100%. Yeah.
All right, maybe we'll try and touch on that. And
Yeah.
the accreditation process is, as an examiner, accreditation examiner, I will tell you, it's the fairest process that I've ever been around. The examiners want people to become accredited, and they work hard to help people, and there's great mentorship, and we're going to talk about mentorship in just a little bit.
Yeah.
So you're a fellow also of the American General Dentistry. You're a fellow of the International Congress of Oral Implantology.
Right.
You've gone through the COIS stuff. You're a COIS graduate. Do they have a term for that? A COIS graduate besides COISian?
No, I think we call ourselves like a COIS tribe.
The COIS tribe.
Yeah.
I call you all COISians. I think it's more of a sort of a Star Trekian feel to it.
Right.
And you're one of the ExoCAD elite members. So you've really excelled in the ExoCAD stuff, and we'll touch base on that in just a little bit. So Diana Tadros, down in Fort Lauderdale. And one last thing before I finally let you start talking. You used to practice up in New York, up in Manhattan, right. And now you're in South Manhattan, as I like to call it.
Absolutely, 100% South Manhattan,
which is the east coast of Florida. So
yeah.
All right.
It's been cool to see all my patients from New York. Now I see them down here. So
when they come down for the winter.
Well, now they moved. Everyone's moving, and a lot of referrals from my colleagues in Manhattan. Everyone's coming down here, so
yeah,
maybe we'll be next. I don't know.
COVID pushes everyone down south these days, right?
Yeah.
All right. So that's Diana Tadros. That's what I have. That's that's the stuff that you Google. Diana, tell us, where'd you grow up?
I grew up in Tallahassee.
And then, so you were Seminole as a kid. You went to Florida State for undergrad.
Yeah. So no born bred. My parents went there too for grad school. And it just kind of when it came to dental school, the reason I ended up at Tennessee is my brother was there finishing his last year of pharmacy school. And University of Tennessee is very unique, where they only let 5 people in outside of the state. You have to be a legacy. So they considered my brother a legacy because he was about to graduate. So that's why I went there. The option to go to UF Dental School was not on the table for my family. Or myself at that point. I had too much pride to go there. But Tennessee was a phenomenal school and program. And I already knew a lot of dental students there through my brother. So it kind of felt like a good fit.
You tell a real interesting story about your journey into dentistry. And we've talked to so many people, Jeff Rouse and Jimmy Key and Amanda C. And it's what I find interesting is everyone's journey into dentistry. It's unique, right? I mean, I was a person who knew I wanted to be a dentist when I was in elementary school.
Right.
But there's others whose path finds them more than they find the path. And I think that's sort of how yours sort of happened. Tell us a little bit about how you decided to go into dentistry.
Yeah, mine was, to be honest, I actually was geared toward medical school. That was my plan. And I don't know if it was really what I wanted at the time, or just kind of what I thought to be medicine was, or that's what you have to go to. But one of my uncles is actually a dentist, and one of my uncles is a physician. And we were at a family reunion. It was my junior year of college. And the one who was a physician said to me, Diane, I'm just going to say this. In my many decades of practicing, I've heard many physicians say they wish they were a dentist, but I've never heard a dentist say they wish they were a physician. And it kind of stuck. And then I went back to my parents. I said, I think I want to look into dentistry. And they were like, what are you talking about? Dentistry? You never talked about dentistry before. So they're like, why don't you go shadow? My uncle practices in Atlanta, the one who's a dentist. And they said, go shadow him for like 2 weeks. It was my summer at that time. See what you think. And I don't even know if I fully grasped dentistry. I just saw that he had this boutique practice. All his patients knew who he was. He was very close to them. And I just felt like that was what my personality was. You know, I
Mm-hmm.
didn't really wasn't even really paying attention to the procedures that much. It just was like the atmosphere of a dental practice compared to when I would go to like my uncle's office, who's a physician, and it's like you're sitting in a waiting room. They ask you what your name is. Do you go there? What's your birthday? It was just this personal experience where you have this continuity of care with people. And I think that's kind of what gravitated me toward there. So luckily the prereqs are about the same, you know, and I just kind of shifted gears and started studying for the DAT instead of the MCAT.
Do you know why your physician uncle said that his friends wish they had gone into dentistry instead of medicine?
So it's really funny because now the majority of my friends are physicians,
Mm-hmm.
and they say the same thing. And I look at it from the outside looking in, and it's a lot of it is, you know, the hours that, you know, think about the years when they finished med school versus dental school. They're still not done. They still have
Right.
another 4 years they're putting in.
Mm-hmm.
And then on top of that, a lot of the medical insurances that they're dealing with and the payouts, and it's a burnout. Most of my friends are ER physicians, and it's a tough gig to do
Sure
ER,
is.
12-hour shifts, and they're seeing maybe 40 patients, and you know their hands are tied. And you know, my practice, we're fee for service, so I'm not really in that insurance game, but I understand it, and it's tough. I think it's getting harder for medicine to practice really good quality medicine and not be tied by the hospitals, the insurance, and whatnot. So
Yeah, I mean, I agree for sure, and I think that's a common thing. It's interesting that your uncle vocalized that to you. I think
yeah,
that's what a great, loving, and you know,
right,
important opportunity for you to be able to sort of reconsider. And very brave of him, right? Very courageous of him
yeah.
to say that to you,
Mhm.
and then for you to then take it to heart and actually start considering that that might be a different path for you. That's great. And then you get to follow along your path, and here you are.
Yeah. So it
How do you
wasn't, yeah, I didn't have I always wanted to be a dentist story. I did, you know, but
And in my
I got
story,
here.
I liked my dentist. He was a nice guy. I knew I wanted to treat people. I wanted to be in the
Right.
healthcare industry, and my physician was kind of a jerk. And that was sort of it for me. It's like
Right.
dentist, nice guy,
Yeah.
physician, jerk. I'd rather be a nice guy, and that
Yeah.
was sort of
Yeah.
like my path, not knowing anything about dentistry.
Mhm.
How did you end up going then? So you did your dental school at Tennessee, and then you were off to UF for your residency. Was it a GPR? What type of residency did you do?
It was an AEGD.
AGD. Mm-hmm.
I knew about this residency program before I even knew what dental school I wanted to go to. I knew I wanted to do this residency program. I was tipped off by I think it was a guidance counselor in college that mentioned this residency program. And they told me to go intern there or shadow them for a week. So my senior year of college, I went and shadowed at that program. And it's funny enough because I'm actually friends with the people who were residents that year. So they were like 5 years ahead of me, but I know them now. Like they're my
Mm-hmm.
colleagues and friends. But I shadowed there. And then every summer I emailed them and said, can I come back and intern? And I interned like every summer, like for a week or two. I knew I wanted to do that residency program. He was taking them to Dawson. They were doing implant educators. I mean, they were the type of dentistry, the level they were learning things out was just like, I would go back to my dental school and we were, you know, doing big stuff. And I'm just like, God, I just can't wait till if I can get into that residency, you know?
Yeah.
So it's just what I was getting exposed to. And Dawson was one of the clinical instructors there. We had a lot of great clinical instructors that would come by that program. And then the year before, my senior year of dental school, Dr. Porter, who was the director, said, you know, you extern here and you're going to apply. And I said, yeah, you know, I hope I get it. And so that was kind of, it was a running joke that I was the longest resident they've ever had. They had me for
Took you a
6
long
years.
time to get through that program.
Yes. So that was, you know, I detached it from UF. I didn't care that it was UF. I just knew that program was solid. I had to put everything aside and alliance aside because that was, I think, to this day, what really set my path in dentistry. So
I think it's interesting. We have a lot of young listeners, or in dental school currently, or just out. But as someone who's been at Marquette for so many years, and now I'm part of the mentorship program, commonly dental students will ask, should I do a residency? Now, I did a GPR when I got out of school, and the reason I did a GPR was because I was very confused about how the facets of dentistry fit together. Like, I understood restorative dentistry, I understood endo, I understood perio, but I couldn't put them all together.
Right.
And I was hoping that the residency would help me start to link these pieces so they weren't such unique disciplines. I can't say my residency did that for me. It did give me a year to mature a little bit and see some stuff I wouldn't see otherwise. But
Right.
what advice would you give for people when they're sort of, you know, they're in their third year of dental school and they're starting to consider like what are they going to do afterwards? What would you say about residencies, people who would be good for residencies and maybe people who residencies aren't the right people for?
Right. So, I graduated, most of my close friends in dental school had their dad was a dentist. So they were going to go into practice. So they had this built-in mentorship throughout the whole dental school
Hmm.
years and when they finished. And although my uncle is a dentist, I'm humble enough to say that it was different dentistry than what I wanted to see, what I wanted to do, And he says all the time, he's like, he likes his bread and butter dentistry, but what I was seeing in residency was not what I was seeing in his practice. So if I had the option to go there, I didn't feel like I was going to learn. But
Sure.
for me, it wasn't so much the hand holding. What I felt like I really saw in the residency was a chance to have like camaraderie with other dental students from other schools. They all come in with a different experience and what they've learned. And then we have these just top tier educators that are bringing us all together. And it was just a nice year of a transition between going from having your colleagues every day, then you have a smaller group, but a really astute, intelligent group, and learning more complex things together. And it's only going to make you more valuable as a clinician, more marketable too when you're looking for an associateship.
Mm-hmm.
And the worst thing I hear dentists say is, well, you're not going to make any money. I could go out and make money. I'm like, if that's such a short-term goal, the money I'm making now was because I took the time throughout the years to invest into like better dentistry and high quality dentistry. And this 1 year gap that you're going to get where you're not making the money. I mean, how much money are you really going to make as a first year associate at a DSO? And what kind of dentistry do you think you're going to be doing at that practice?
Yep.
So if you are someone who is, money, like is the driving force, this is, you're going to be comparing yourself to your other colleagues that are out there first year practicing. But if you're someone that just really wants like this to be a career that you take to the grave and not be burned out from it and not, just churning your wheels, trying to see 100 patients a day to get there, then I never saw the downside to residency. I just didn't, I never looked at my colleagues that were practicing my first year while I was on weekends at CE and said, gosh, I wish I was doing that. And said, I never did, because I really saw the value in like that program.
Yeah, I think that's great advice.
And I think all programs, they're set differently, but you have, many dental students don't know this. You can go to these programs in the summers during your dental school years and ask them to shadow for a couple of days, see if this is something you'd want to do. You'll see very quickly that it might be a lot different than what you're learning in day-to-day dental school. And that might be it's almost like free CE in a way, because you're going to learn more complex cases and be guided throughout them rather than paying, $20,000, $30,000 to go to an implant course. You get to do it in residency, and have some hand holding. So I would tell them, if you're on the fence, shadow them in your summers or your weeks off. See if you can get into just programs to just a couple of days and see if it's something you'd want to do. And most dental students that do that, they end up saying, yeah, I kind of do want to do this. Like, this, I saw some really cool things at that residency program that I'm not seeing, at my dental school. So
how was it for when you're going back to school and you sort of touched on this, like you're seeing these things when you're doing your internship and then you're getting back to dental school. How did you manage the conflict between seeing things done in a different way,
right,
could say better way, but a different way? How did you manage that conflict?
So I think the hardest thing for me is I started to get more, like I knew that the residents were going to Pankey and Dawson, and there's just only, dental school makes you barely not dangerous, basically.
Safe beginners. Beginners is what we would say.
Basically what it is.
Safe beginners.
You're not fully understanding the occlusion of that, or you're just trying to get by. So I think for me, as I was trying to start learning more about what I would hear in the summer, I start reading, trying to this was before there was all this videos, everything online. There wasn't that much content. And I was trying to I remember I bought Dawson's book. I was trying to read, understand it, and bring it in. But the thing about me is I'm a pretty obedient student. I knew this was just, I had to get through this step to get to the next step. And I had to get through this step really well to be considered in a position for that residency. But I would tell, I was like, oh, I saw even crown lengthening. You think now looking back, it sounds so crazy. I thought that was such a thrilling procedure, but I didn't get to see that in my first year of dental school. I didn't see that, So, and not to say that, University of Tennessee had a lot of exceptional programs and clinical programs, but, back then, you didn't really have any implant exposure. Now I think the dental students are learning, everything about grafting, and that we didn't have much of that. That was for
Sure.
the surgeons, that was for the period residents. So to see that, in a residency, I'm like, wow, like I'm going to be doing this like literally right after I graduate. That's insane. I haven't done it at all. So there was a level of excitement, but I kind of just tucked my head under and just, I wasn't trying to, I'm not a confrontational person. I just knew that was what was on the other side. So.
Okay. I think it's one of the things I speak about when talk to young dentists. When I was in school, we had very limited materials. I mean, we were using gold, we were using gold foil back then, we were using amalgam, and composites were just coming into practice when I was there. So in our dental school education, we had to learn an inch of material, but we had to learn it a mile deep. In today's dental school, there's so many products, so many materials, things that are changing. You have fourth, fifth, sixth, seventh generation adhesives. We were just in the infancy of adhesives when I was in school. So the challenge, I think, for dental students today is they don't get to learn at a very high level any of the things, right? They might do one technique on using, whatever adhesive they're using. They might get one denture experience, where we were getting tons of experience doing the same thing over and over.
Right.
So we came out, I think, better prepared to jump into the wilderness of dentistry. Whereas I think today's students, it's a real challenge. And I could see where a good AGD or a good AEGD program would be really helpful for those who want to get better at it and have a safer entry into dentistry. That'd be my thoughts.
Mm-hmm. And it's, and even if you take a snapshot of like today's dental schools, every dental school is so different in the experience the students get when they graduate.
For sure.
And I didn't realize that until I went to residency. So when I went through UT, they didn't have an endo residency program yet. So we did all the endo. And we did a lot of surgery in our program because most of the oral surgery was kind of off-site. When I got to residency, I had people who had never even done endo on a live patient before in their dental school, or maybe had only got to cut 2 crowns. So like, for example, in New York, they are required to do a residency to practice in New York. And I think a lot of that is because they may not get as much experience in the dental school itself because they're larger dental schools classes. So even just doing your research on the dental schools themselves, just into like which one is offering what type of experience is important to know, even going into dental school.
Yeah, that's a great point.
So
yeah, they're all remarkably different. You wouldn't think so, right? But they're very different. Everyone in what they're able to, how they're going to educate their students and the materials they're going to be able to provide. So
true. Yeah.
How did you end up in New York?
I actually just ended up in New York kind of on a whim. I had finished residency. I practiced for about a year and a half in Tampa, Florida. And I had a lot of friends that were not dentists, but outside of dentistry that were in Manhattan. And at the time I was visiting back and forth with them, and I just really liked the city. And I found pretty quickly a really good associateship job there. I interviewed, for long distance. I said, I want to move. And I didn't think I was going to be there long term. I was going to be there for a couple of months. I was like, why not? I'm young, I'm single, let me do it. And it just, it was a great practice. It was a phenomenal practice. She really taught me a lot in dentistry as well. And that's where I started to link up with people like Adamo and another, really people that I respect in the industry. And I stayed in Manhattan for about 6 years. And then I had a really good practice opportunity down in South Florida. And then I took it. So
you were in the Upper East Side. Is that what I remember?
I was in the Upper East. That was toward the end. I had took on a position on the Upper East for about 3 days a week. And then I was also mainly in Gramercy. So
oh, that's a great area also.
Yeah. And it was, like New York, I think in New York to do, you have to be exceptional in Manhattan to stand out, because there's so many dentists.
Right.
Even in our building alone, I think there was like 150, 200 in that building. So that's where I really started to hone more on cosmetics, because that's the market in New York. So
one of the things that I've tried to do in my career is continue to learn, and I've always been super curious. And I always said that, I'm not worried about people being smarter or better than me because I would just simply outwork them. And I will tell you, I'm glad you are not in my community, because I don't think that I would have been able to get any sleep at all, because I think you're tireless. And so I'm wondering, so like, are you like, genetically, are you part like equal mix of like easily get bored, little ADD, super curious, like it's like this mixture of stuff that seems like you have just kept on going and going and going. And I'm wondering what the genetic formula is that has you going through all the educational things you've done beyond your dental school, beyond your residency. So as we talked about, you're accredited with the AACD, you're a fellow of the AGD, you're a fellow with the ICOI, you've gone through the COIS programs, and now you're doing the exocad stuff. So do you just get bored easily,
You know, I guess I do. It's not that I get bored. I think I get like antsy, and I think it's almost like this. Like every CE I go to, you know, some people go to CE and think they're going to learn. You know, it's at 100% learn rate, and if they don't get 100% learn rate, then that was a failed weekend course. For me, it's like if I just go and learn one or two tips that make it better for me to incorporate into my practice, it's a win. You know, and that's kind of how it became. And honestly, a lot of this, you know, COIS Center, all that came because of mentors that told me, you know, I remember telling Adamo, I said, you know, I did Dawson and I've done this and I've done that. And I'm just kind of like, I'm bored now that a lot of the CE I'm going to kind of seems a little bit redundant. And he said, do COIS. And I'm like, I don't want to do, I don't know. I don't want to do another occlusion type-esque thing. And he's like, just do it. If you don't like it, I'm going to pay for the first course. And I went and it was this, you know, with COIS, he just has this way of explaining everything, and it's the energy and the passion he has for our profession. And that's what really drew me into the center at first. But I do get, you know, maybe I get a little bit antsy. I think that's what brought me into exocad heavily. I was getting tired of waiting for labs to do wax ups, and I was trying to go through accreditation, and all the wax ups would not pass accreditation. So I just kind of was like, all right, you know, I'm just going to do this myself and that's how it took off. But I don't think it's genetic, because I look at my parents and they're chilling on retirement. They're not itching, trying to do anything crazy now. My brother's like, you know, I'm going to go to the hospital and work, come home. It's not like, so they kind of laugh at me. They're like, is this another fellowship award like we have to go to? Like, are you done now? Like, so I promised them I think I'm done. I don't know.
Dad's got to pull out the suit. Mom's got to go get a new dress. And
I know. It's the only time he has to pull out a suit is for these like accreditation and fellowship awards.
Right. Well, you strike me as someone who's just super curious, you know, sort of looking through your background, and you got this super high energy that you don't, you know, I think one of the challenges in dentistry is like in anything, if you want to excel, you got to be able to get knocked down and get back up. Right. And I think one of the misbeliefs or the things that people don't understand is that there's tons and tons of failures. We're going along towards our path to success. And I don't remember who said it. It's not the number of times that you're knocked down, it's the number of times that you get back up. Right. And so I'm imagining, Diana, that you're someone who just has this resonance that I'm gonna get through this. I can see through to be able to get to where I'm going. Is that pretty true?
I think it's pretty true. I mean, we see, you know, every dentist has failures, and you know, my thing is I own up to it, and I'm humble with the patients and I explain to them what happened. And the reason I tie myself so much to CE is because every time I kind of learn why it happened, you know, and so it doesn't happen again. Because if you're having to redo your dentistry over and over and over again, it's a long road, you know. And I see that in the practice that I bought a Panky practice, and he's a phenomenal dentist, Dr. Holtz. And he told me when I bought the practice from him, he said, Diana, all I want is the ability to redo my own work if it fails. And at the time I'm thinking, wow, sure. But it's because he knew he was doing such great dentistry by that point. Even to this day, Dennis, I probably maybe only had to redo like one filling of his in 3 years. Like his dentistry is so methodical, and he took his time, and it was just, you know, and I know I'm sympathetic to the fact that not everybody gets the luxury of sitting in a fee-for-service office where you can spend that time doing this kind of dentistry, but that doesn't stop you from getting that kind of knowledge to know that, you know. And that's where I was like, you know, this is the kind of dentist I want to be. Like, I want to be able to sit in a future person that's buying my practice 30 years from now and say, oh, let me redo my dentistry, knowing that it would be rare if it was just failing all over the place, you know?
Correct.
And now, you know, of course, our patients are aging, things like that. But when I have to look at the dentistry itself, it's not the crown that failed, it's the root that failed. It's things like that when you can discern what it is that failed. It wasn't his dentistry, you know?
Correct. So, yep. I understand that for sure. Because I'm at that point in my career where I just, you know, and it's fun when when you get to look at the dentistry that's come in and you know,
Right.
did procedures 20 years ago and you're looking at the dentistry and it's still maintaining, and it's really rewarding and super fun, but it's been because learning the rules and following the rules all along, and hopefully then you have success that way.
And I'm sure you've heard this, dentists, a lot where dentists will tell you, well, I don't do bondings because they don't work, or they break, you know, and you're someone who's so exceptional at bondings that you're probably just like, is it the bonding that doesn't work, or is it you that doesn't work in this situation? So,
well, I speak directly to that because when I joined Buddy Mopper's practice, I was awful at bonding because it didn't work in my hands. And I had seen Buddy lecture, and of course, I was very young and I was very, I wasn't very humble. And so when I would listen to Mopper, I was, you know, I was learning, but not really learning. I wasn't following exactly his protocol. Maybe I didn't understand it. Maybe my ego was just in the way. I'm probably a lot of both. Nonetheless, when I got into Mopper's practice, I recognized that it was all about me and my limitations and my, you know, my limitation in my learning of the materials. So it was all about me. It wasn't the materials, it was about me. And I speak openly about that because I want others to enjoy doing composites as much as I get to do it now. I had to learn the right way to do it.
Right. It's true.
So I want to talk about mentorship because you brought that up and it's one of my favorite topics. And because I can tell you, I wouldn't be where I am today if it hadn't been from people like John Coyce, Frank Spear, Buddy Mopper, Corky Wilhite, so many other people, and even going back to dental school, some of my instructors that were so helpful in guiding me. So I want to talk about when you met with Adamo, how did that all work out? Because Adamo's a good friend and he's so inspirational. How did you guys connect?
Adamo is, you know, needs no introduction, and he's as excellent as he is humble. And when it came time to do the accreditation process, it was hard because, you know, he was a friend too. And in the accreditation process, and I didn't realize this in the beginning, you're going to be knocked down. And I failed. You know, people think that I went through, I failed 2 cases going through the process. And it was 2 cases because I fought him on it. I wanted to submit it and I was like, it's going to pass. And he's like, you know, Diana, I liked it. And I remember the first time I did a case and he told me he doesn't think this would pass. I didn't talk to him for 2 weeks. I was so mad at him. And then finally he was like, you know, if you're going to do this, then you have to set aside the French. I'm not, you know, it's not like I'm crapping on your dentistry, but I'm trying to get you to this level of X. And that's why people really, I think, steer away from accreditation, or they kind of laugh at it because they think they've got it down. And it's not that you can't do exceptional dentistry without going through accreditation, but when was the last time somebody actually examined your work and your private practice? You know, that was the first time in 10 years that I've had my work evaluated by somebody, you know, even as a colleague since residency. And we go through this bubble when we start practicing where nobody tells us how good our work is except our own patients, and our patients don't know what they don't know, you know? So that's the value of accreditation, is you have these people who are actually, you know, top tier in this specialty that can actually sit down and show you how to make it better. They're not telling you your dentistry sucks. They're just telling you, like, you know, this is how you can really take this from a C to an A+, you know, and it's long-term, it's longevity for the patient too, you know, it was everything, bonding protocols, you know, gingival architecture, everything. So yeah, it was a hard experience for me. I wanted to give up many times because it was the first time that I'd been, you know, basically knocked down by a friend. And I was like, what is this? You know, I don't want to do this anymore. And but like you said, I'm very like curious, and I'm one of those people that I'm just like, I have to do it. I already started it. I would commit, we were closed on Fridays, but I committed Fridays to accreditation days. I would bring patients in on Fridays that I wanted to do my accreditation cases on. I would stay nights. I would come in weekends with them. I was doing most of these cases for free. I lived and breathed the process, and not because I cared about the title. It was because I just wanted to prove to myself, like, I could do that kind of dentistry. Like, maybe I'm not always going to be doing 6 or more composite veneers in my geriatric practice patient population. But if a patient came in my door that needed it, I wouldn't be the one to say, well, you have to do porcelain, because bondings aren't going to work, you know? So I just wanted to prove to myself, like, do I have the hand skill? If I sat down and practiced enough, do I actually have hand skills to do this kind of dentistry, you know? And it made me better with collaborating with my lab. It made me better with collaborating with my specialists, with my patients. Everything was a win that I didn't even expect to be a win in that process. And our friendship is even stronger now. He's actually coming to my course next weekend for Exicad. So it's kind of crazy because I've been to his courses and now it's like this
Full
weird
circle.
full circle. Yeah. So.
Well, I think you bring up something that's really important when you're talking about mentorship. You said that you didn't want to talk to him for a couple of weeks after he had come in and critiqued you, right?
Right. Yeah.
This is, I think, because I hear this a lot, and I act as a mentor for the AACD, and I have some mentors through Marquette. This is, I think, critical for the relationship between the protege and the mentor, is that there has to be an understanding that this is professional, and so when you're giving guidance, then it's not a personal attack, right? You're doing this for the best interest of the person that's there. Right. And so I think has to be sort of like this contract, this covenant between both people in this relationship, that the person who's giving the information is giving it in a caring, loving way. You're doing it to help the person, and the person who's getting the information has to take it in such a way and understand that this person who's giving their information, it's not easy for them to say these things, right? They don't want to hurt the person, but they're so interested in people's growth. I think John Coyce is one of the best at being able to do this, right? Yeah, he's able to be caring, but also give valuable feedback, right? So I think for those who are listening, I think if you're asking for mentorship, I think you have to be able to step back and understand there's a responsibility. And if a mentor is recommending something, then do it.
And another thing I'll say to this, and it bothers me from the outside looking in, is people need to, I think the most important thing is mentorship is a two-way street. What I mean by that is a lot of these mentors that are out there that are giving their time are holding their own courses and holding their own lectures. And like with Adamo, yeah, I could go to his office and sit there for 4 hours, and he would, of course, he's a nice guy teaching me composite, but he also has a course. And if you have a mentor that is teaching courses, go to their courses, pay to be a student, support them the way they support you. And I think that's the hardest thing for me to see is sometimes, mentors, and a lot of my colleagues now are teaching class, and they'll say, oh, the student, they'll just message me all day, or they want me to teach them like photography over the phone, or they want me to teach, and it's like they have active courses for them they could go to. So I do think like mentorship, it cannot just be this ATM machine where you're just pulling from them and you're not providing support to them too. I mean, if you like what they're doing and they're teaching exactly what you want to be, support them, promote what they're providing for the community. That's how I feel about that. So
well, I think that's really well said, because there's a limited amount of time in everyone's schedule and everyone's day. And when you're at the point where someone's asking you to mentor them, it's because you've been successful, and that if you're successful means you're probably busy, and so your time is limited. So I think that's really well said, and I think that's really good and valuable. And plus, then you're in while they're doing the teaching, and you're going to get it in a different way. And then you very often it leads toward being able to assist them in those roles, and you learn at a higher level, and then you get to get more opportunities. So I think that's really really good said. Well said.
Thank you.
And I'm sure today you're being asked to be mentors for people as you've gone on and gotten further in the career, and especially with Exicad and stuff.
And it's tough because Exicad and I think Adamo said this. This is actually the second time he's come to my course. The first time he came was just to really support me, because my inaugural course was last summer, and he actually said it to everybody. And he said, "Listen, Diana is teaching something that we don't have any exposure to, so you're learning from scratch. I teach composites, which we've all kind of played with composites a little bit, or I've done something where maybe everybody has a little bit." So the hard thing about Exicad, and we get a lot of new dentists that are like that will email me and say, "Oh, I want to come learn the software." And then I'm like, for me, it's like, there's so many other things you probably should pick up before you get to the software, because the problem with Exicad is you're taking the power away from the lab to do occlusion.
Correct.
You're going to do it yourself now.
Correct.
And I would be pressed to believe a dental student understands occlusion to the level that a lab that does it every day does,
Correct.
Or a dentist who's even been seasoned enough. So that's what I even tell these dentists that come to these courses. When you are starting to do your own wax ups, you're taking a lot of things that you don't see behind the scenes that happens when a lab does your case and sets it up, or a designer. They are working within the confinements of understanding, hopefully, the occlusion, the table, if they're opening the bite, all that. And if you're going to do that yourself, and if you don't know what you're doing, you're only going to mess up the mouth faster.
Yes.
So for me, and with Exicad, I don't actually let, dental students, or I don't teach them like that. Most of the people that come through the course are graduates of Pankey, Coyce, and they understand, because if you're going to do this yourself, this is an undertaking, you know,
right.
to do this. So I do get that. And I try to help as much as I can. But again, the software is kind of, it's hard to explain it over the phone to anybody, or I'll do remote sessions with people who've already taken the course. Most of my time mentoring is with people who've already taken the course. Because we're about 150 dentists deep on Exicad. So those are the ones that I kind of prioritize because they already have the software.
Yep.
So I can help them, you know, navigate it. And that's just my priority because they know what they're trying to do in the software. Whereas somebody who's just coming because they saw on Instagram that you can do this, you know?
Right.
And so I'm trying to be more open to the shadowing, but if it's hard to have just someone come in and want to, I feel like there's other steps they need before you just start doing your own occlusion on digital, you know?
When you started out in your path, you ended up going to Kois, but you had a Pankey background beforehand through.
I had a Dawson
background.
I bought a Pankey practice. So I had Dawson beforehand.
But all on the centric related dentistry, right?
CR
dentistry,
correct?
Joint position. So one of the questions also I get quite commonly from dental students and young dentists is which CE should I go to? Should I go to Pankey? Should I go to Dawson? Should I go to Kois? Should I go to Spear? Should I do DOT, for instance? How do you recommend, or what do you say to people when they start asking that?
So I used to say Dawson because Dawson is what I knew. When I look now, you know, Kois is kind of the way he has it structured, and he's kind of it's him teaching it every day, all day. You know, that to me is very appealing because it's like, you know, he could, if he wanted to, step back and have other people just teach for his curriculum, but he's so invested in the center and dedicated that Kois is where I would say to start. And I don't ever tell people I wish I did Kois so much sooner, because the truth is when I did Dawson, I didn't understand, it didn't make sense to me because I did it in residency and I hadn't seen my failures yet. I hadn't seen so to say, oh, I wish I did it, you know, my freshman or like first year out of residency, I don't know if I would have grasped everything. You know, I would have picked up half of it, but I probably would have had to retake it many years down the road, because there is something that just can't be bought. And that's the time and experience of practicing dentistry day in and day out. You know, you can take all the CE you want. If you had all the money in the world, you could take it all your first year out. But until you're practicing it and seeing it day in and day out and how it's working long-term on every different type of patient and every type of occlusion and what their occlusal scheme is and patterns, it might not click the way it's supposed to, you know?
Well, I think implementing is for sure. Like, so I started out with Spear, and then, and this was the old days when Frank was teaching in his office before there was a Spear Center. And then I went and I did Dawson, and I went through a bunch of the Dawson stuff. And then I went back to Spear. And it was, you know, because the things that they were teaching in the beginning, I just didn't hear it. You know, I was just picking, you know, there's only little things that were making sense to me. And then, you know, so Frank would talk about the facially generated treatment planning, and I would get some stuff for that. And then I understood some occlusion stuff. And then for me, Dawson brought some occlusion stuff better together for me. And then I was also learning from Jim McKee about joints and stuff like that. And then I was back out at Spear. And I just had to keep hearing it. And then as I was implementing it, it was just starting to make more sense. And it's like, and then I would go to lectures like, gosh, is that the first time he said that? Or is that every time? You know, I've heard Frank speak on this 5 times, and this seems to be the first time that I've heard it, but it's the same presentation because I wasn't ready to hear it.
Yeah. And I think no matter which way you swing it, an advanced curriculum on occlusion is important. Before you get into cosmetics, you can do, you know, I did your course, I've done Adamo's course, I've done cosmetic courses. You can do cosmetic courses all day long, but if they don't last, your patient's going to hate you and you're going to hate yourself, and you're going to just start blaming the material. But if you understand occlusion and what would work on what patient, you're going to win, you know, in the long run. So I think that no matter which way you swing it, any kind of core curriculum that involves itself around understanding occlusal principles, you know, is key. So
thank you for saying that, because I agree 100%. Start with occlusion, cosmetics come next. I think what's really interesting is young dentists that'll start out and they'll be doing these big all on X implant courses, maxi courses, but they don't know occlusion.
Correct.
And how scary is that? I mean,
it is honestly the basis of everything. And I was just going to get into that. I was like, even if you're doing dentures or implants, you have to understand occlusion for these procedures and restoration types to hold long term. You know, and that's just there's no way around it. It is literally the foundation of dentistry. That's it, so.
I think because it's, at least for me, it was hard to learn. I didn't understand it. And not only is it hard to understand, I think it's hard to teach. And so I think there's only, there's a certain number of people who can make it so that the information's easier to understand. And I think there's a ton of implementation in practice that takes time to appreciate it and all. Whereas, we're mostly carpenters and plumbers, right? So we're really good at, getting out the old hammer and chisel and getting something done. But things like occlusion take longer to learn, and you have to have implementation. And so I think people get maybe distracted from wanting to learn it because of the process it takes to learn it, where the other things are,
you're right.
Give me a screwdriver and give me a drill and I can get this done, where this is something that's going to take a lot longer to figure out. But it's so critical. It's critical for everything we do.
And I think the thing is, and I understand when you're an associate, it may be hard to come back to a practice that, it's been run the same way for many, many years. And you say, I just learned all these, this is how I want to start doing my cases and mounting them. But I think if you are in a practice where the owner is so against any new advanced material that you are bringing in, that you've learned, then I would say, get out of there.
Yeah.
Because that's not going to be an environment where you're going to grow anyways. So if I went back and I went to a practice and said, this is how I learned it, this is like, I just got back from hoist or spear, and that's what, if I had an owner that was like this, I want to learn it too. That's the kind of practice I want to work under. And the same thing, even, Dr. Holtz, even though he's semi-retired now, I can pull him out of retirement once a week to come see some of his patients. But anytime I come back from a CE course, he's like, tell me what did you learn? This is great. I want to know, he is still loves dentistry. He's very much into dentistry, and even after all these years, and he came to my course too, and he's come to the AC. He's just, that's the kind of person you want to grow a practice with, so.
Those are really good words. And I think especially because of your career path, right? You started out down in Florida, you went up to New York, and then you're back down. So you've had several opportunities.
Right.
And I think this is really good advice. And for young dentists out there, it's a challenge to sort of figure out what the type of dentistry is that you want to do. It's a challenge. So you gotta dip your toes in, you got to start taking courses, you got to get a feel for it. And then when you do know the type of dentistry you want to do, you got to commit to it. And if you're not in a practice that's going to support it, you got to find your way out and get into a practice that will support it.
True. I would say, I think we would agree, occlusion, and then picking the kind of specialty you want to hone in on. I know there's a lot of dentists that are like a jack of all trades and they do everything a lot, but I've gotten to a point now where I tell patients, I'm humble enough to tell you what I can do really well, and I'm humble enough to tell you what someone can do better. So all my root canals, I'm going to send them out. And it's not that I can't do it. It's just, I know someone's going to do it better at this point, and I just don't do it all the time. And I don't really have a passion for it.
Right.
So it's things like that. Finding when you go, and dentists start to pick it up on their day-to-day, they start to figure out what procedures they really like when they see it on their schedule versus the ones that are like, oh, not this on my schedule. And if you're going, oh, not this, repeatedly on something, find a way to just stop doing that.
Right.
And spend more energy and CE into the things that you really naturally gravitate towards. So
well said. I couldn't agree more. I stopped doing endo and oral surgery early in my career because I was just awful at it. I mean, and I didn't like it. And I didn't like it because I was awful at it. And I tried to get better, but I was still awful at it.
Right. And it's just, it's natural. I actually started really liking surgery, and then I got to New York, and then I really started to like cosmetics. But because I did so much surgery, I can kind of play them off each other at my practice. Sometimes I am going to do the anterior implant because I want to guide where I'm going to place the tissue in the emergence profile and things like that. But it takes time, and it does. It's, people, I think the biggest complaint the younger dental students talk about is the money.
Right.
Constantly the money. And I get it. The student loans are bad. They are, they're getting worse and worse. And it is hard, but there's also a lot of great free CE too. That can start getting you plugged in. And I go, when I started Exicad 2.5 years ago, I would go to YouTube and plug in like Exicad, just how to do this. And it was like nothing, like here's music videos, watch Britney Spears instead. Now it's like people are posting, from all over. It's become so there's so much on like, and I don't want to make them a YouTube dentist, but in the meantime, it's enough to get you kind of maybe figuring out what are the procedures, what's the methods, what is the bonding protocol for using this, that kind of thing. So.
No, absolutely. It's you got to start getting your toes into the water, and you got to start working your way through. Let's talk about exocad, because my partner, Chris Ching, he's been using exocad for several years.
Yep.
And so we're our practices, I'm analog, he's digital.
Yeah.
And quite honestly, I think there are advantages for analog, and I think there's super advantages for digital. The advantages for doing analog, so I do my own wax ups and I do them in composite. The advantage for me is I'm continually developing my hand skills every time I do a wax up.
Right.
I'm literally practicing. If I'm going to be doing a composite case, I'm practicing on the patient before I do the case. So there's super benefit for that. Developing my hand skills makes it better for me for when I'm recontouring temporaries, when I'm evaluating the porcelain work for my ceramists, things like that. But the time it takes is significant. And especially with digital dentistry and digital design, if, for instance, we do a smile preview or a trial smile, show the patient what it would look like, and if I do a hand wax up and it's not right, I have to go back and I got to start re-waxing. And if Chris does his digital design with exocad, he can do his smile design. If the teeth were too long, or maybe came out canted, or whatever it is, right? Maybe didn't bring out the buccal corridors enough or too much, whatever. He can, in a minute, go back, change things in exocad. It'll take him about a minute or two. If he wants to select different teeth from the library, he can do that, different shapes. And it's a 5 or 10 minute project instead of me spending the hour doing the wax up. And then he just pushes a button, gets it over to the 3D printer, and off he goes. Right. So I think, without question, I mean, it's the future for sure. I am concerned for younger dentists not developing their hand skills as they become more dependent on digital, because bottom line is we're still going to be working in the mouth. Right. But that's my 2 cents on analog versus digital. I want to talk about your pathway into exocad during COVID and all, but tell me about your thoughts on analog versus digital based on what I just said.
I actually mirror your thoughts. I love that you said that you do your wax ups in composite, because I do my wax ups in composite. When I used to do wax ups hand, I never did them out of wax, because for me, I just work better with composite, and it's what I was going to use in the mouth. So it makes sense to do it with composite, and I can polish it like composite, and I can get an idea of it. Where I was getting really frustrated with my wax ups doing stone is, 1, it does take time. 2, I'd have to carry my, like, where I'm going. And sometimes once 5 o'clock hits, I don't want to sit at the office anymore. Right. And I was on a lot for CE. So it was like, I'd have to wait, I'd have to have these designated times after hours that I was going to sit there and do it. That's where and obviously I wasn't doing it in multiple units, my problem with my practice and me starting to incorporate a lot of cosmetic into the practice is patients, to tell a patient, well, you got to pay $2,000 for a wax up for you to decide if you even want to do the case.
Yes.
That's where my slough off was. Like, people are like, I'll think about it next time I come in.
Because that $2,000 was to pay for the lab fee
for the lab to just do the wax up. Now,
exactly.
I felt it's worth the cost when they're hand waxing. And the first time I got a digital print back instead of a hand wax, and it was still the same price, I was like, I felt cheated. I was like,
$70 a tooth for them to just,
yeah. And then I didn't know, and Dennis, I didn't even know what XCAD was then. I just was like, what is this thing that you sent me? Like, where's my hand wax? They're like, oh, it's a digital software now we're doing. And I'm like, so shouldn't it be cheaper? Like, I didn't know that it still takes time. I just thought they were plugging it in, it was spitting it out. Yeah. And I just said, well, I'm pretty tech savvy. I think I want to buy this software. Now, they said, I don't think a dentist can buy it, Diana. I was like, really? They're like, yeah, it's a lab software. So I called Dexicad. I was like, hey, I'm a dentist and I want to buy your software. And they're like, why? What do you want to buy it for? And I'm like, I want to do my own wax up. So like, oh, that's crazy. Like, why would you buy this software for wax ups? Like, dentists don't buy this for us. I'm like, well, my lab's doing it. I just want to do that part and they can do the rest. I didn't know where it was going to go at the time.
Sure.
And they fought me on it, as if it was like going to be this $100,000 software. And I'm like, what is the cost of this thing that you're hiding from me?
Right.
It's like, oh, what you want would only cost like $2,000. I'm like, well, that's the cost of one wax up.
Exactly.
Give me the software. So I get the software in my office. It is a huge learning curve. At the time, there were not training centers yet out. Even Exocad does not train directly to consumers. Right. And I just plugged in. I dedicated hours, but you're right. There's still some things I look at when I get a hand wax up. I still have my lab do some wax ups. And I tell you, it's that same concept of like me for endo. It's not that I can't do it. It's just, they can do this case better. Mm-hmm. How long would it take me to wax up, 2 arches, opening the bite? how long is this going to take me? Is it worth my time? And, you know, at that point, if a patient's going to do a full mouth reconstruction, they need to pay for a lab wax.
Right.
You know?
For sure.
And could I do it? I could do it, but there's a beauty in, like, even my ceramist MJ at one point said, Diana, here's my thing. I love that you're doing all these wax ups digitally and everything, but I'm very lost in the case because I'm so used to being able to do, like you said, you and I say, being able to wax it first. So I know what I'm doing when I go to hand layer the ceramics. I have a practice run. Now I'm just getting the preps and your wax up scan. And I'm so lost on what was there, what wasn't there, where, you know, they're lost. Right. So, and when she said that, it totally clicked to me. I was like, you know what? I need to swallow my pride and I need to let the lab do what they're comfortable doing in some of these cases, you know? But I agree with you. There's still a beauty to analog. I look at even the 3D printed wax ups, and they don't have that great tertiary anatomy that hand wax does, you know, that they can put in. You lose a little bit in the print, and you lose even more when you make the putty off the print. Mm-hmm. So, and then you put it in the mouth off Lux Temp, and you've really lost a lot of that definition. But like Chris does, it is a quick wax up for a patient. I can show them in maybe 3-4 minutes. And then now it's a hybrid. I tell them, if you like this, then I'm going to have the lab do a definitive one off this. And I'll send her my photos with the picture and the scan and maybe even the whole project itself. And if MJ still does hand wax, so she'll turn that into hand wax. But now we have a happy medium where the patients get a preview. And if it's a simple case, I'm going to do the wax up, you know, I'm going to print it. But if it's more complex, the patient gets to preview, they understand where we're going with this. And I'm going to tell you, most patients have never seen this kind of technology. So they're already like floored. They're like, oh, well, I mean, if you're putting all this planning, my last dentist who did my veneers, they just stuck me and then threw something in my mouth, you know,
so true. For
sure. Like once they see that, and you only have to highlight 1 or 2 things, like I'm going to bump the gum here. You see how it doesn't match. Once you start showing them that on the front end digitally, they're like, oh, like, they got it. They know that you know what you're doing and you're planning it well. So, but yeah, there is a challenge to going digital, especially when you want to do virtual mounting and things like that. It is a challenge. And I don't think it quite is as great as it is analog, but it's getting better.
Yes.
And there's ways now with the reference glasses and even face scanning that you almost don't need some of the armamentarium you needed for analog.
Yeah. Well, and I think it in many ways, it's certainly the path that we're heading and stuff. And right. I'll tell you a story. I took this is 100 years ago. I took a Photoshop class from Greg Lucky, who's down in Dallas. Mm-hmm. And this is before we had all these opportunities to share our cases with our patients on how to do things. So I was always the dentist that would show the patient the wax up and say, hey, this is what we can do for you. And of course they'd say, oh, great. And then they'd leave. Mm-hmm. And then Greg taught me how to do Photoshop. And I remember the first time the very first case, and I worked on it when I was down at the course with Greg, and I Photoshopped this patient's smile who had worn teeth, and I made the teeth the right shape and stuff. And she came in for a consult, and I showed her the before and then the Photoshop. And she literally said, when can I get started? Yeah. And I called Greg and I said, I feel dirty. I feel guilty. That was like, you know, I didn't go through the wax up. And I mean, I went back and then I did the wax up after she committed to it and stuff, but it felt so wrong. But right. You talked about how you'll sit down and you'll do your exocad in front of the patient, and you'll be able to move teeth and show them. And I think that's a huge advantage that they can actually, you know, they can be part of it, because then it becomes interactive, right? This is about them and not about you. This is how you can help, you know, design your smile.
And if you do this right, you become the biggest referral from specialists too, because my orthodontist is a huge referral for me, because I will show them digitally how much tooth I'd have to cut if they don't do ortho first. And the software shows it. It highlights where it's cutting through and what and patients are like, you know what, I think I will do that ortho. I'm going to go back and I'm going to have her finish off the ortho case. Or even when we get down to the end of the ortho, my orthodontist always kind of pauses, brings that patient to me. I scan them and I show them if I need to move the spaces more. You know, when you got like peg laterals or anything, where do I have to put the space to work naturally? And you don't really get to see that so much in a stone cast, because you don't get to put it on their face. You know, software, you've got the face, you've got the teeth, you've got the high smile line. You can see what you have to do with the gums and this. And maybe it's not 100% what you're going to end up doing in the mouth, but it's pretty close. You know. So that it is patient communication, but it's also specialist communication if you do it right, and it's lab communication as well. Yeah. And just getting a place for the face in any kind of wax up is huge for a patient, you know.
Yep. Then it becomes ownership, right? They get to sort of
Right.
see the process and they get to
Right.
understand better, and then they get to make
Right.
better decisions. What's the
Right.
best treatment for them?
Right. I actually had I had a surgeon that called me that he had referred a patient to me, and we did a whole whack everything with them. And he said, I need the documentation that you did. My lawyers asked me, I said, why? I said, this patient doesn't think things were planned well with the surgery.
Hmm.
And it actually worked as legal documentation. They brought the whole Exicad project and all the pre-planning and all the, the face scan in and everything like that. And once their lawyers saw all that was done to plan
Right.
the case, they dropped the case. They're like, this was not a poor. So it actually even works as, weirdly enough, as legal documentation for planning,
That's a great story.
Mm-hmm. And I was like shocked by it, but I'm like, yeah, I guess you would use this as it's a legal document,
That's
So,
awesome. Diana, I'll say this: you're inspirational.
oh,
You
as
really
are
are.
you, Dennis, thank you.
It's true, because this every endeavor in dentistry it just takes time. It takes effort. It takes getting back in there and trying and retrying, and I'm not a computer person, and so I've dabbled in Chris's exocad, and I
Right,
know I need to do it. I know I need to do it because I'm going to be practicing for a
right,
bunch more years. So I know I need
right,
to do it. So I'm going to
right.
come down and take your course because
Anytime.
I
Yeah.
need to get down there. And so actually several of us have been talking about coming down to do that. So
Yeah. I mean, and it is, and I tell the dentist, grant yourself some grace when you come to this course. It's a brand new concept. It's not like when you go to another CE and you know the word porcelain or composite and you're just honing your skills. This is a brand new concept in software. And I think that's the hardest thing is people get just, frustrated because they're not exocad experts in 2 days.
right.
And you're not an expert in anything in dentistry in 2 days. How long did it take you even in dental school? How many classes did we take for composites in dental school and
For
prep
sure.
and whatnot? And then still the years we took to prep it. So it's just practice. But the nice thing is it's a little hard to learn, but it's very easy to master. And
Mm-hmm.
once it gets fast, it gets really fun.
Right.
So,
And the nice thing, like you said, is that if you just want to do it for a smile design,
right.
you can create a printed model for that, and then you can send it off to the lab to finish it
Right.
up once the patient accepts the case.
Right.
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 So you
That's
don't.
what I tell. That's what I tell most dentists. Within Exicad, it has a inter-channel communication where
Right, which is nice about CAD.
Yep. It'll just get sent to the lab that's using XCAD and they'll get that project and they'll work off that and they can send it back to you in that channel and you can tweak the lengths if you want and send it right back to them. And so it's this communication portal that goes back and forth. And that's what I tell dentists, when you get stuck, work with a lab that has XCAD and they're going to finish, you play this bounce back and forth game. I know Midwest uses Exicad heavily,
Right.
so there's a lot of big hitters in labs that are using Exicad,
Right.
that is their software. So,
And then the nice thing, it's not like 3Shape, which is limited to, 3Shape users. Anyone can use exocad.
Anyone can, any scanner,
And any scanner can.
email. And that's what I really liked about the course is because, even though like I am a KOL for Sprint, right, the printer and all that stuff, the nice thing about Exicad is I get to see so many dentists who are using all different types of technology and they are able to use this software. So,
right.
We get a lot of CERAC doctors, we get a lot of people who are working off desktop health printers, we get a lot of people who are using all different types of mills, and it's just so cool because the software, it's for anybody, it's not, you can, at any point in your digital workflow, you can use this, so I like that because I get to stay, connected with dentists who are not in this one stream of, I have an iTero and I have a Sprint Rate, so.
What's the biggest misconception you found with dentists coming in to start doing digital design, like with exocad and stuff? Like they come in and you're like, yeah, that's not quite how this is going to be used.
The biggest misconception of, is it plug and play? Because that's what they're used to. Most dentists that have come to our course, I would say 50%, actually 100% already have a scanner, which is plug and play. About 50% of them have now incorporated a printer in their practice, which is pretty plug and play. If you have an STL file, maybe it takes you a day to learn how to use the software. So they're expecting something in that realm. When it comes
sort of like a DSD,
Correct.
type program.
Right. And like the issue with DSDs there's no issue, but the thing with DSDs, what they're not understanding is DSD is using Exicad. You're going to take the photo, you're going to take a scan, and they're going to design it on it and bring it back to you. And then maybe they bring it back to you really fast. So you think it's this 1 minute thing, but
right.
That's, I think, the biggest misconception. What I started to really pay attention to it before dentists like sign up is I tell them like, are you the one who does the digital in your office? And they'll be like, oh no, my assistant does my CERAC. She's the one who does all that. I'm like, bring bring her instead. Bring her with you because, and you'd be surprised assistants pick it up faster than the doctors.
Oh,
so,
I'm not surprised at all because my
yeah.
assistants scan a million times faster than I do in my practice.
Right. So
They're
I
way
was
better at it.
shocked because my practice, everyone at my practice is over 65. So I'm doing everything. So when I started seeing people bringing assistants, I'm like, wait, I went back to my office and I was like, someone needs to learn how to scan because I can't do this anymore.
Right.
So that's what I start asking now. Who does the scanning in your office? Who does, there was one team that came, Nick Gravino, he came with his staff to my XCAD course in June, and he brought 2 assistants, and they already have like a lab mill, and they're already working off of a software similar to XCAD. And we're all just watching his assistants because she came up to me, she's like, well, I already did a full arch wax up on the upper. I mounted it virtually on the virtual articulator, and I already checked the occlusion. I made a bite splint for the lower. Now, how can I convert these into I'm like, what are you doing here?
Is she for hire?
I asked her, I was like, if you like the North, you're really going to love Fort Lauderdale.
Right.
They're not going anywhere. I've tried. So, but that's the thing, they're eager to learn it. It's something outside of the chair side dentistry for them. And that's exciting for them because we're doing everything. They're suctioning for them. They're not really, it gets mundane for them, but when they get to do something like this, it's cool, so.
Oh, that's great advice about bringing, for those who are listening, boy, I tell you, the more we can get our auxiliary team, our assistants involved in this, the tighter you can make them, anchor them into your practice. And I don't know what it's like down there, but boy, we're still challenged on building our team and things we can do to separate our practice from other practices and give value and things they can get to do and be part of. That's so critical. And it just makes it, like you said, so much more enjoyable for them because they get to do things that they wouldn't be able to do otherwise, which is so super cool. And
they start to market it because they like to do it. And, some of the doctors, their assistant is the one who takes the photo, does the scan, and initially sets up the case in XCAD for them, all while they're seeing another patient. And then they come in real quick and tweak maybe the lens or whatnot, and then they show the patient. So it's like, they've got this, they're talking to the patient about like, we'll set it up for you digitally. We do this together as a team, and it's a win for the practice. It's a win for the patients. So, if you said you've got a staff, your assistant is doing phenomenal at scanning, she would probably run with that. I mean, Chris should have her doing the XCAD now at this point. So.
Well, Chris just loves doing the XCAD, so he gets enjoyment out of it. So
it's like a techie video game thing.
Well, he is, right? He's very techie, so he enjoys that. And I think he gets great joy. And I think there is something, like you said, I think the interaction with the patient is so critical for the dentist. For me personally. And yes, I know there are teams or there are offices where the team does a lot of that interaction with the patient. I like that interaction. I want to have that one-to-one. And I really like, though, when you talked about being able to move the teeth while the patient is there so they can see the differences. All right, well, let's make it shorter. How do you think that looks in your smile? Let's make it a little bit longer. Interactive. They get to own that. And I think that's you cannot do that in an analog world.
And sometimes for me, a huge thing is moving the midline. Because I can move the midline digitally and show them, but then I can reduce the transparency of the waxes so they can see how much tooth underneath I actually have to prep to do that. And then it starts to click to them that I do have to go to ortho. Like, this is not, and they don't want to lose tooth structure, but they don't really grasp it. And my problem with doing it analog is you lose the tooth underneath. You don't really know where you were, you're kind of lost in the shuffle, and you can't just peel it off and put it back like you can with a digital software. So that's kind of another thing is sometimes I'm usually convincing patients out of treatment than into it with the software because I'm telling them, but I feel good about that because they know what they're getting into. And I feel better that I didn't just whack off half a tooth just because they think that's what they want, so.
Well, I think the thing you talked about being collaborative with your orthodontist and with your periodontists, all your specialists. So you may not do this case and you're going to send that off to the orthodontist instead. But the reality is now you have this pipeline with this orthodontist who's respecting that. And so our referrals in our practice, our heaviest referrals are orthodontists, pediatric dentists, and periodontists. And because we're sending so much to them to make the cases better. And that's without question, those are my biggest referrals beyond patient referrals. And they're the best referrals because they're already sold. They have a relationship with the orthodontist or the periodontist, and then they've already been sold on why they should be seeing you. And I encourage every dentist out there, build these collaborative relationships with your orthodontist, periodontists, endodontists, pediatric dentists, everybody, and feed them patients. and watch how it comes back and how it helps generate your practice.
And my orthodontist is a very heavy marketer in our area. She's phenomenal, don't get me wrong, but she also gets so many patients that come to her first that don't even know who they would go to.
Oh, perfect.
So she'll say, and they're like, they play that game with them all the time. Do I need ortho or can I do this with veneers? And she's like, let me stop you. There's a girl down the road. She's going to put it on a digital software. She'll send me the design and we can all look at together. But the funny thing is now she says, from all the patients she gets from me, there's never confusion. With every other dentist she get, like they don't know what with her, she's like, I don't even have to talk about the case. They already know what they're doing because of the midline. They usually have like the video. I send them the web view of Exocad so they can look at it on their phone. She's like, they already know. Like there's no, the discussion is so little, and specialists love that. It's
right.
It's
yeah. If the case is pre-sold when they walk in.
Right. It's then, just, they're not, an uphill battle with the patient. So they like that and they respect that because it's not like I'm not just a sales tactic. It's not, it's based off logic. So
yeah. And they get to see it. Right. And that's such a big deal, especially in today's world. I mean,
right.
People need to see it. They need to have ownership and the medical legal aspect of it, that they've been informed. So if they decide, you know what, I'm going to do it restoratively, you've informed them, you've shown them at the highest level, and they've taken ownership. So if nerves go bad, you've talked about how you've had to prep the teeth more than ideal. So you've protected yourself.
And it's funny because, and you could probably sympathize with this, a lot of dentists know what AACD board accreditation is and all that. We get it. We respect it within our field for the most part, but a lot of patients don't know. So people will say, well, yeah, you don't have to do this because you're already board accredited. So you could just tell a patient you're board accredited. Like, I don't really use that. And even if I did, they still want to, there's things they're going to see that they're probably not going to see in other offices. You can do virtual crown lengthening in front of them, things like that before you have to touch them. So people have this misconception for me that I just get all these cosmetic cases because I already did an AACD and I of this Instagram and all that. And the truth about Instagram is it actually is more of a dentist referral than it is a patient, because most demographic patients that are on Instagram are young. Yes. They don't really have the finances to pay for something they're looking for. So most of what my referral is dentists that have someone who's moving to Fort Lauderdale, and that's who they're sending. So people think there's this misconception with me that I'm just churning and burning all these cosmetic cases all day long. I don't even have to show them an Exocad product or anything. And that's just furthest from the truth. Like we do day-to-day dentistry in my office all the time. So you still have, this has still been my biggest practice builder, is being able to, and I sit with even if a patient is sold on a case, I'm still going to show them digitally what I'm doing, Right.
I think that the more I do this, the longer I've done this, the more you share with patients, the more they have ownership in their dentistry. Mm-hmm. It's win-win, because not everything is going to go smoothly. Right. I mean, I did a tabletop onlay on a patient, tooth number 14, and it's come off a couple of times, but I talked to him about it before, right? I'd rather not prep your tooth down for a crown for these reasons. Now, here's the downside with these tabletop onlays, because I don't like doing same-day dentistry, because I don't like the stress of it. Chris does that. I don't. It means that you're going to be in a temporary, and it's possible the temporary might come off. And I'm sorry in advance. This is one of the downsides of the tabletops. But the good news is that you're going to have a great restoration that will be permanently bonded on there, and you'll have it for a long, long time. So, so he came in yesterday morning at 8:00 for me to resubmit it, and he's totally cool with it. He gets it. We're saving tooth structure, and he's in on that.
Yes. I always tell them, let's try the most conservative thing first. If it doesn't work, we can always be more aggressive later. And I've never had a patient be like, no, just do the crown part. Like, they love it. And they'll tell my staff, she told me that it might not work. She said that when she did it, but she was really trying. I know she was trying her best to save what she's got. And I'm sure for the same for your practice. So I think if you say it in the beginning, it's a reason. If you say it after, it sounds like an excuse. But patients respect it, and they don't get to see that a lot in offices, that people go straight to crown, and so it's just even like a little time up front, and they tell their friends, they're like, go to my dentist, she sat there and she went through everything. And
that's exactly it. And for people who want to do fee-for-service dentistry, this is what you have to understand. You got to spend the time. You got to slow it down. You got to be able to explain to patients what the treatment options are and guide them through the process. And you can't do it in 15 minutes. You got to spend the time and build these relationships and build trust. And then you can start doing the dentistry. But that's the difference between an insurance dependent practice and a fee for service practice is how you're going to spend the time communicating with your patients, I think.
And it's important because everybody has this whole, like, when I do a startup, I'm going to do fee for service. And I obviously it's, you know, it's an ideal practice setup. But one thing I tell dentists is when you're working in insurance practice, they are loyal to the insurance.
Yes.
When you're working in a fee for service practice, they are to the dentist. And that's important to know when you're buying a fee for service practice, because even me coming in with what I thought were all these accolades, the patients were like, wait a second, now, you know, I was only coming to him outside of my insurance because it was him.
Yes.
The way our staff kind of worded it was like, listen, if you're going to try a new dentist, you might as well try one in the same office that everybody else that you know is in.
Exactly.
That he handpicked than going to a random insurance dentist. So, and I get this a lot with dentists who buy fee for service practices. They want to change everything. Right. They want to go in, they hate this, they hate the hygiene, they hate all this. And I'm like, listen, it's so important to keep him. And I kept my previous owner because I loved him, and yes, he's a phenomenal. And I still, to this day, if I could have him every day there, I would. But he kept that transition where attrition was basically nothing, and yes, he was the one who had to guide it, not me. I had to sit back. I sat at the front like a receptionist half the week because it was still his practice, and the patients didn't even know when the actual transition happened. But to do fee for service dentistry, you have to really treat the patients like, you know, like they are a family member, and you have to be sympathetic to the changes that are happening in the environment. I was always compared to the Disney VIP experience. So I did Disney VIP for the first time with my family this past summer, and instantly I went on YouTube and started to find training videos for Disney VIP, because it's just, every step is just so well done, and like it's impressionable on customer, you know, and that's what you want in your practice, you know.
They're valuable, and you have to treat them as such. And it's a different mindset than when you're churning and burning, when you are going to sit down and start doing dedicated dentistry and build these relationships, which is, for me, was why I went into dentistry. I wanted to have these relationships, like you talked, like your uncle spoke about the difference between going into medicine and to dentistry, and the ability to have these type of relationships with patients long-term, right?
Absolutely. Yep. Mm-hmm. So you're selling your practice? Is that happening soon? Let us know.
We are looking, everyone out there listening, we are looking to bring someone in to join us. So we are, we're fortunate. We're too busy, and we need help. So anyone who's out there listening, you can DM me on Instagram at Hartlieb DDS, and I will.
Can I sell my practice and join?
Come join us. Are you kidding? Chris would be in heaven, man. You two would be geeking out, and I'd just be sitting there. I'd be in the lab working my composites.
I thought I was going to move to Chicago. That was my dream city after residency. My brother lives there, actually. They're in Amherst, and I thought I was going to go to Chicago, but then I ended up in Manhattan. So you never know. I'm constantly changing. Maybe in a year or two, maybe I will.
The weather's not quite so nice up here, so it's beautiful now, but it's going to get ready to change soon.
It's all fine. It's all fine.
Diana, I cannot thank you enough. You're inspirational. I mean, the energy that you have, and for our dentists out there who are listening to this, first of all, tell us how they come in. They're going to find you on Instagram at Beauty in the Teeth.
Yep. Beauty in the Teeth. Yep. That's my practice name also. So I'm there.
And then if they want to come in and they want to start learning exocad, how do they find you for that?
Yeah. So I think there's a link on exocad. My training course is called exocad Elite. It has its own Instagram page, but I'm sure on my Instagram page it's linked. The classes are full, but there is a wait list, and we just go off the wait list every time we open up a new date. But they can message me too. I always like to talk to them directly, because I always want to know where a dentist is in this process. You know, It always kind of helps gauge, is this going to be a good fit for them? You know, is this something that you want to do? Some of them say, well, I'm not going to quite do it yet, but I want to go ahead and take the class. And to that I say, well, then wait when you're ready, because if you take the class and you don't get the software and you're going to wait 6 months, you're going to forget everything, you know?
Right.
So I always want to make sure we're finding them at a right time for this, entry into digital. So
how many people do you, how many participants are in each course?
We do about 25.
Okay.
25 is really pushing it.
Yeah, no doubt.
Yeah, it's everybody gets kind of stuck at different points when we're, even when you're just trying to show the workflows.
For sure.
And you're dealing with all different types of skill levels too with computers. Some of them haven't even worked off of a PC computer in the last
That's
years.
my problem. I'm so used to Apple. When I go to a PC, I want to bang my head against the wall.
Yeah, unfortunately, it's a very resource-heavy software. It's not formatted for Apple. So even teaching people how to use a PC computer, again, can be a thing. So 25 is kind of our sweet spot. We bring in Exocad and we bring in Exocad experts. And it's really unique because to get an Exocad expert to sit down for 2 days straight would cost thousands, but they come in, they fly in, and we utilize a lab that uses Exocad all day long. That's Evolved Dentistry. So generally what will happen is they'll come to the course and then they'll learn. And then if they get stuck in course cases moving forward, they'll use that lab to help them finish off the case or whatnot, or whichever lab they like. But yeah, so 25 is kind of a small group, but it's all hands-on, and it's a lot of information in 2 days, but it's good information. It's how you would do the kind of dentistry you'd want to do on digital. So
I'm excited to get down there and learn it, because I've tried been
you can
looking
come as our guest of honor.
Well, that's very sweet. I've been looking over Chris's shoulder, but that's not the same as me sitting down and actually doing it.
I know it's tough, and even me, I still try to look to see if there's any Exocad courses that I could go to. Most of them are international because you learn something from everyone. There's no real manual. I created my own for this course, and it's because the software is just limitless. There's so much you can do in it, but it's just nice to see how other people do it. I'm sure Chris does things that I didn't even know you could do. And even Exocad, when they come, they're like, oh, we didn't even know you could do that with the software. So it's like there's things that we're all learning it independently, and it's nice to bring everyone together to.
It seems like a really sharing environment. I mean, just talking to Chris, it seems people are really open, and people are just, and as he started with Mesh Mixer and started and so everyone just sort of, it's a great community. People trying to just bring up the level of what we're able to do. So
and that's why I think the reason it is digital dentistry, the community is so solid, is because we're all coming from different specialties. There's people who are doing this for surgical. This is the one time we're all coming back in. Outside of dental school, digital dentistry is bringing us all back together to learn from each other. When you go to AACD or when you go to like oral surgery, you're confined in the same type of demographic, but digital brings us together, and we all kind of set our egos aside because we're learning it together. You would be an a-hole, no offense, to say you know everything in digital dentistry, because I mean, even just last week I got the new version of Exocad, and it's totally different, and we train on it next week. We have to show them, so it's like it's changing too much for you to know it all that well. And that's why I've rarely come across anybody who has been really egotistical in this. More so it's with the printers. People seem to have printing wars of what printer is better. But the only liquid resin or liquids I like to fight over is alcohol. I'm not into that. So I let them have it. My printer works for me. If you have a, easy bake oven and you're making something out of that, good for you, So, but yeah, that's why Exocad is so open systems and the procedures you can do and what you're using it for. And I think that's what's drawing all this dentists back together, so.
Oh, that's really cool.
Yeah.
Diana, thank you. Any parting words for our listeners?
No, I think I said too much. Or no. They're like, shut this girl up.
So who is Florida State playing this weekend? I've not looked at.
You know what? I think it's Boston College. I actually even paid attention. Honestly, I have my workshop coming up next week, and I leave for Spain to lecture for Exocad, and I put it off on the table. So,
quite honestly, the way Florida State's been playing. Yeah, you don't need. It's okay to not be looking at this.
We did pull out the win with OSU, but that was not a big win at all.
No,
there's about 3 games that I really care about in the year on a shitty season. No offense.
Right.
It's usually Clemson and it's UF and Miami.
Yeah.
Outside of that, I'm like, it is what it is. We're not trying to win a championship this year, but yeah. So.
Well, that's all right. All right, for my Dental Online listeners, thank you so much for joining us for our Sharecast, and as always, yours for better dentistry. I'm Dr. Dennis Hartlieb. Well, thanks so much for listening or viewing our Sharecast today. If you enjoy this and you want to get more information from Dental Online Training, then check us out at dothandson.com. That's one word, dothandson.com. Now, as a reminder, DOT has so many other great opportunities for your learning. We have our Wine and Unwind monthly webinars where we engage real time with our viewers as we bring in leaders throughout the dental industry to bring you up-to-date information and answer your questions. We have our monthly coffee and donut study club sessions where our participants bring in cases and we treatment plan these cases together to help you bring great treatment to your patients. We have our live virtual workshops where our dental online trainers perform the same techniques from their kits as I'm doing from the comfort of their own home or office. We have our blogs and we have endless selection of our hands-on pre-recorded technique courses to help you improve the clinical dentistry that you can provide for your patients. That's right. With our on-demand courses, you do these hands-on exercises when the time is right for you. So check us out on Instagram, Facebook, or LinkedIn at Dental Online Training. And hey, be sure to share this with your friends and colleagues who you think might benefit from this Sharecast and everything that DOT has to offer. And now, how about one of those coveted 5-star ratings? Please go to your site and help us by getting the word out to others. And we'd welcome one of those wonderful 5-star ratings. This episode was created with special help from Claire O'Neill. It was edited by Ashley Dixon Ellison and with original music by Chris Peterson. Again, thank you for listening. I'm Dr. Dennis Hartlieb, yours for better dentistry.